Officer of Narangi Anchalik Mahavidyalaya and technical coordinator of this webinar. Welcome our esteemed speakers and participants to the international webinar on challenges of human capital accumulation in developing countries, organized by Department of Economics in collaboration with IQAC of Narangi Anchalik Mahavidyalaya. Thank you. Now I request Jayanta Barua, Assistant Professor, Department of Economics of Narangi Anchalik Mahavidyalaya, to start the proceedings. Over to you, Jayanta Barua.
Namaskar. A very good morning to all the international guests and good evening to one and all present in today's webinar. I, Jayanta Barua, an Assistant Professor of Department of Economics, Narangi Anchalik Mahavidyalaya, welcome all of you to the international webinar on challenges of human capital accumulation in developing countries in the wake of COVID-19. This international webinar has been organized by the Department of Economics, Narangi Anchalik Mahavidyalaya, in collaboration with IQAC, Narangi Anchalik Mahavidyalaya. At the very outset, I'd like to offer my heartfelt thanks to Google Meet and YouTube for giving us an opportunity to organize this international webinar. Before going to start our session, I'd like to request all the participants to mute their audio and switch off their video. And I also request not to press on presentation button or presentation mode. Thank you. Well, human capital accumulation is the process of acquiring and increasing the number of persons who have skills, efficiencies, expertise, knowledge, education, and experience, which are very essential for economic and political development of a nation. Education and health are the two main sources of human capital accumulation. Understanding the importance of these two important sources of human capital accumulation in today's world, more particularly in developing nations like India, and how pandemic situation created by COVID-19 has been affecting these two important sources of human capital accumulation, we have organized this international webinar. I am very hopeful that this international webinar will be an enriching experience for all of us. Now, without much delay, may I now request the coordinator of IQAC, Narangi Anchalik Mahavidyalaya, Rita Sharma ma'am, to come up with few words in her welcome address. Over to ma'am.
Thank you, Jayanta Barua. Namaskar. A very good evening and a good morning to you all according to your time zone. I, Rita Sharma, coordinator of IQAC, take the privilege to welcome you all to this international webinar organized by the Department of Economics in collaboration with IQAC, Narangi Anchalik Mahavidyalaya. Today we have with us two eminent personalities, Professor Hirendra Kumar Nath sir from Texas, US, and Mrs. Neelam Kolita ma'am from UK. They will be introduced before us by Jutika Borman Chaudhary, HOD of Economics Department. Hope the sessions are going to be very fruitful and informative. After the deliberations, we will have a question answer session where our queries will be answered by our esteemed guest as much as possible, keeping in mind the time constraints. So, without wasting much time, may I now request our principal, Rita Dr. Hazarika ma'am, to say a few words and inaugurate the webinar. Thank you, ma'am. Over to you.
Thank you, Rita Sharma. Namaskar, everyone. I am Rita Dr. Hazarika, Principal in charge of Narangi Anchalik Mahavidyalaya. On behalf of our college, I would like to thank every one of you participating in this webinar. This is our 8th number of webinar in series and the second international webinar. It is a very great pleasure to welcome you all to this event. Webinar is a celebration of knowledge, sharing of experience, and source of information. We are very fortunate to have our resource person, Professor Hiranya Kumar Nath, Department of Economics and International Business, Sam Houston State University, USA. Sir, I extend my heartfelt welcome to you to this international webinar organized by the Department of Economics and IQAC of our college. I wish to extend a warm welcome to our second resource person, Neelam Kolita, Health Economist Senior Research Fellow at University of Southampton, UK. I welcome you, ma'am, to this webinar. Now, I would like to extend my cordial welcome to all the esteemed participants, including our GB member, Dr. Dharmendra Nath, Principal of Deora College, Dr. Padma Sharma, HOD of Economics, Cotton University, Sanjeev Bardalai, Director, Department of Statistics and Information Management, RBI Mumbai, Dr. Narayan Sharma, pediatrician, founder, secretary of Assam Jatiya Vidyalaya, Dr. Polly Bhekulint, director, Women Study, Guwahati University, Hemasri Hajorika, deputy secretary, printing and stationery, Government of Assam, Dr. Mukunda Sharma, principal, Bhavanipur Anchalik College, and faculties of different colleges, my colleagues, my students to this webinar. The harder you work for something, the greater you will feel when you achieve it. I hope the webinar will be great in success, and I hope you will enjoy it. Have a good time. Thank you.
Thank you, Principal Ma'am. I, Dr. Jutika Bormon Chaudhuri, HOD, Department of Economics, Narangi Anchalik Mahavidyalaya, welcome all the participants to this international webinar. I also welcome the honorable speakers for the day, Hiranya K. Nath and Mrs. Neelam Kolita. Given their experience and academic background, I am sure that this webinar is going to be an enlightening experience for us all. Our first speaker for the day is Dr. Hiranya Kumar Nath. Dr. Hiranya Kumar Nath is a professor of economics at Sam Houston State University, Huntsville, Texas, USA. He is an adjunct professor at Tezu University, Assam, and an academic editor for economics at PLOS One. Professor Nath held visiting positions at the Indian Institute of Technology, Guwahati, India, and the Queensland University of Technology in Brisbane, Australia. He also taught at St. Andrews University in Osaka, Japan, and China University of Mining and Technology in Beijing, China. He has traveled extensively throughout the world, visiting universities, presenting his research, and teaching students. Dr. Nath has published in many highly regarded peer-reviewed journals like Applied Economics, California Management Review, Comparative Economic Studies, Economic Analysis and Policy, Journal of International Trade and Economic Development, Journal of Macroeconomics, Review of Development Economics, and many more. Dr. Nath earned his PhD in economics from Southern Methodist University, Dallas, USA. He attended University of Delhi for his bachelor's and master's level education in economics. He earned an MPhil degree in economics from Jawaharlal Nehru University, New Delhi. Professor Nath was born in Bornagaon, a village near Mongoldoy in Assam, and was raised mostly in Telamara in Sonitpur district. To create awareness about Assam, he has established the Assam Scholarship at Sam Houston State University. He also works with rural communities in Assam to create an enabling environment for individual as well as collective peace and prosperity through Good Neighbor Initiative. Sir, Now I request you to start the session.
Thank you, Dr. Chaudhary, for a very generous introduction. Good evening, everyone. Respected Principal Ma'am, and all the dignitaries and my dear friends. First of all, I would like to thank Narangi Anchalik Mahavidyalaya for giving me this opportunity to speak at this webinar. This is a trying time, and I hope you all are safe and doing well. Of course, we are in the middle of a pandemic and we don't know when it will be over. So we need patience, we need to be careful, and we need to be healthy. I hope you all will survive and you will do well eventually. So having said that, let me start with my presentation for today. So the topic today is challenges of human capital accumulation in developing countries in the wake of COVID-19. And I will be focusing my presentation on education in India. My co-speaker, Mrs. Kolita, will be talking about health and therefore education, which is one part of human capital. That's what I will be focusing on. So let me start with a few stories. A few years back, I think it's 3 years back, I met a boy in my hometown of Mongoldoi. He back then just finished his class 12, higher secondary, and then he was about to take admission in an engineering program in Guwahati. He did not do very well in higher secondary school leaving certificate exam, but he cracked the combined entrance exam, and as a result, he was admitted to the engineering program. He is from a low socioeconomic background, and therefore he could not, or his parents could not afford a lot of things. And of course, he could not take advantage of the coaching for the engineering entrance, or for that matter, any other entrance exam. So when I asked him, so how he prepared for the entrance exam, he told me that he would, once in a while, he would borrow the phones from his acquaintances, or sometimes when he's in school, he will borrow the phone from his friends during the recess, and he will watch those YouTube videos, which essentially is about how to prepare for the entrance exam. And he went to the government school in the town. He, of course, did not go to any private school. And when he said that without going for any special coaching, he actually cracked the exam by watching YouTube video, whereas his higher secondary exam actually did not go very well. He had a second division. I was quite amazed, and it gave me hope in the sense that, well, somebody, if he has the mind, he can, or he or she can actually do well. And also, as somebody who has been studying information and communication technology, and I can see the potential of this technology for a country like India, I thought it was great. That was the story from 3 years back. My recent story, which actually happened yesterday, I talked to two students in a village close to the place where I grew up in Sonitpur district. I talked to one girl and I talked to one boy, and they did extremely well in high school leaving certificate exam, which is the matriculation. And I asked them what they want to do. They were very clear about what they wanted to do. The girl told me that she wants to be in civil service, and the boy told me that he wants to go to NDA, National Defense Academy. And both are from low socioeconomic background. Of course, they have started their higher secondary 11, 12 at private schools. And nowadays, as you know, the private schools, they generally try to get these extremely bright students, or extremely bright meaning the students who do very well in their HSLC exam, and they try to nurture these students. In general, I normally would not encourage these students to go to private schools, because I always think and believe that we should have a very robust, very good public education system, at least at the school level. But this is an extraordinary time, and I thought that I was happy because these schools, they did not charge them anything. Their admission was free. They did not have to pay the tuition. But at the same time, these schools also have started online classes, and these students did not have access to the internet or access to the ICT devices. And as a result, of course, they had difficulties. And at that point, one organization was trying to help these students. This organization is collecting unused phones from people, or they are asking for help from people who can afford to buy a phone for these students. So that's and so as a result, these students probably are being helped. And this is another story. And when I talk to other students in my village, some of them, they also got into government schools, but their classes have not started, and they don't know when exactly they will start learning or start their education process. So these are interesting stories. These stories actually give us the background for what I am going to talk about today. Now, one of the very first lessons that we learn or we teach in economics is human capital accumulation leads to economic growth. Now, when we say human capital, it includes both education and health. Well, in fact, human capital includes education, experience, training, as well as health. And as this human capital increases, those countries also produces more goods and services. That's kind of the very classical economics or new classical economics, right? But then if we extend or if we go beyond just economic growth, when we discuss human development also includes education and health as two important components. Of course, it also includes income. And that goes back to one of the approaches that we use in development economics, which is called the capabilities approach. And Indian Nobel laureate Indian economist Amartya Sen is one of the proponents of this approach. And what it essentially it says that this education and health, these two components of human development, these contribute to the people's real opportunities to do and be what they have reason to value. So there is a philosophical kind of undertone or philosophical background of this approach. But by getting educated or by having a good health, you can enjoy the freedom to choose or freedom to do what you want to do, and that kind of contributes to overall human development. And that is very important in the context of India. Of course, our education system. So again, as I said, since Neelam will be talking about health, I will not talk about health. I will focus on education. If we look at our existing education system, of course, there are many problems or many deficiencies. There are deficiencies in quantity, there are deficiencies in quality as well. If we look at deficiencies in quantities, of course, India is a very large country. It has more than 1.3 billion people. It is the second largest country in the world. The most important thing or most important aspect of our population is that we have a young population, meaning the median age in India is 28 years. That means half of 1.3 billion people are under the age of 28. That means if this 650 million people, a large portion of that 650 million people, which will be twice the size of the US population, if they want to get education, so that will need a huge education system. I am not saying that we do not have a huge education system, but we do not have enough in order to provide education to all who actually need to be educated. Now, under various government schemes at the central level, we are now trying to get education for everyone in the age group of 6 to 14, right? But if you look at the scenario for the higher education, it is not yet at what we should be. In the age group of 18 to 24, the total only 25% of the people have access to higher education. So we do not have that many colleges and universities to satisfy all the needs. For example, we have about 1,000 universities, both public and private. We have about 10,000 independent institutions, and then we have about 40,000 colleges. And this number is not large enough to satisfy the needs of higher education in India. If we look at quality, again, there are variations, but then I don't think we have yet to do a lot in order to improve the quality of our education. I will talk a little bit about that quality later. And also the other sad thing about our education system, over the years, it has become an exam-centric system. That means it has more oriented towards examination or test, assessment-centric system. However, in this kind of system, it benefits only the top 5 or 10%. This is kind of a ballpark number. I don't have the exact number, but it benefits only the top 5 to 10% of the students who do well in exams. That means this education does not really benefit the students who are not in that elite group. And again, if we want human development in India, and for that matter, any other developing countries, it has to have an education system which will educate or which will add value to the human being without discriminating. And that does not happen in a system like the one that we have. The system does not teach 21st century real life and workplace skills. And I am not hesitant to admit that as teacher, as an educator, even the education system in the United States, we are not keeping up with what's going on in the world. Of course, here in the United States, the education system is very dynamic, the curricula is very dynamic, but I still feel that we have not been able to keep up with the changes that are taking place in the real world. Of course, what plays an important role in this is all kind of societal inertias. And the societal inertias come from social norms, social values, cultural values. And these inertias, of course, complicate this educational attainment of everyone in the society. So these are some of the challenges we already had even before COVID-19, right? Now, COVID-19 came in the beginning of this year. And of course, this human capital accumulation process, right? The process of accumulating human capital through education and through public health and healthcare, that has been disrupted. Of course, exactly 4 months back in India, the national lockdown was announced on March 24th. And so the entire nation went on lockdown since March 25th, and it went on until the end of June. Of course, in different phases, over time, some restrictions were lifted, but what has happened is the schools and universities have been closed for this entire period. And at this point, we are not sure when they will reopen. Of course, some schools and colleges or universities, they have been doing certain things. Okay. Well, there were some instructions from the government or from the higher authorities to teach remotely with vague guidelines in the beginning, right? Even now, I don't think we have clear guidelines. As a result, well, there have been attempts to learn and teach remotely, but that has not been very successful. Now, if you look at what has been done by the authorities or by the government, of course, they have developed certain apps, or they have developed a few online materials. For example, in Assam, I think SEBA, Secondary Education, Board of Secondary Education, I think they have developed an app called EduAid. And NCERT, they have developed an app called ePathshala. But then when I talk to my cousin who is a teacher in a village, I don't think she is aware of, or she knows how to use this app, or how she can teach, or how she can make it valuable or useful to her students. Okay. So as a result, there have been significant learning deficits in last 4 months. At the same time, those who work, they also are not accumulating experiences. As I said, human capital is broadly defined to include even experiences and training that you have at your workplace. And again, people have not been working regularly. As a result, they are not accumulating experiences. So that part of human capital accumulation is also not taking place. So as a result, as you can see, there has been major disruption to human capital accumulation. So if you purely look at economic growth perspective, then obviously it is going to affect economic growth in India in the long run. The other important aspect of this is there have been differences across states. Some states are being more proactive in order to teach their students, but some other states are falling behind, and that might lead to regional differences in this human capital accumulation process, and that may lead to the regional differences in growth experiences or development experiences across states in India. And again, even if you look at individual students level, of course, as a result of these attempts that have been made in order to teach and learn remotely, some of the students probably are doing okay, particularly the kids from middle class background. living in urban areas, they are probably getting, because their parents are educated and they are also making an effort to teach their kids, and also they probably go to private schools. Private schools have been more proactive, and they have been probably teaching these kids to some extent. But those who do not go to private schools, do not live in urban areas, they live in rural areas, these kids have been falling behind. And for many of those kids, school is not just a place where they get an education, but school is a place where they get other psychological nourishment. For example, for many of the students coming from the low socioeconomic background, teachers are their mentors. Teachers are the people who they look up to for encouragement for their mental needs. But that has not happened for last 4 or 5 months, and that is taking a psychological toll on them. Besides the whole situation about uncertainty, and that also has probably affected the students in general. And these kids that I have been talking about from the rural areas, from low socioeconomic backgrounds, now that their families probably are also facing economic hardship, they probably will have to engage in income generating activities or livelihood activities. And as a result, when everything will get back to normal, they may not come back to the educational institution. And that will lead to socioeconomic divides, or that will lead to kind of more socioeconomic disparities in the future. So those are the challenges. Those are the problems that we are facing right now. Now, of course, people are talking about, or even I, as somebody who have been studying ICT and use of information and communication technology in various aspects of our modern life, or in particular, its application in education. Even for me, I would think that, well, this is an opportunity for us to probably push online education or remote education really hard so that it can benefit our society. But there are certain challenges, and those are the challenges that I will be talking about here. First of all, access to ICT, information and communication technologies, is a big challenge. We do not have universal access to the internet. Internet is one part of this information and communication technologies. According to some statistics, only about 35% of the population uses the internet in India, but that is an overestimate or an exaggerated number because as you know, some people have more than one connections, and when they collect the data, there is no way to figure out an individual person, whether an individual person has more than one connections. And as a result, this 35% is an overestimate. Actual number probably will be much less. And again, the quality of access is not good everywhere. Maybe the quality of access to the internet is good in Guwahati, but it may not be good in Mongoldo, or may not be good in Dhemaji, or may not be good in a remote area. So that also is a challenge, is a problem. Then the second aspect of access to ICT is access to the ICT devices, whether it is the smartphone, whether it is a tablet, whether it is a computer. That also is a huge problem. By January 2019, apparently there is 104 mobile phone connections per 100 people in India, which is impressive, but at the same time you realize that we probably all carry 2 or 3 mobile phones, and as a result, the actual number of people having a mobile phone will be much less. And this is just mobile phone, I'm not talking about the smartphone. And out of the people who have mobile phones, only 35% have smartphones, which essentially will be needed if you want to teach online. And of course, in terms of these devices, ICT devices, India has been leapfrogging in the sense that we did not use many of the devices that have been used probably 20 years back. Some of the kids, young kids, they have directly gone to the use of tablet or to use of smartphone without actually seeing or even using a desktop or a laptop computer. There is huge digital divide, and digital divide along various different dimensions. For example, between poor and rich, there is a digital divide by state. And I was quite surprised. I actually published a paper on digital divide in India by states, and I found that many of the states, Assam is one. Assam actually is in the lower side of this digital divide. And then there is digital divide by gender. For example, men have more access to this ICT and women have less access to ICT. Also, there is digital divide by quality of access. Some states, the quality of access is good. In some states, the quality is poor. So these digital divide that has already, digital divides that have already existed, that will obviously kind of is creating a challenge for transitioning to a online teaching and learning mode. The other challenge for going online is digital literacy. What is digital literacy? A formal definition is an individual's ability to use information and communication technologies to find, evaluate, create, and communicate information requiring both cognitive and technical skills. Most of us have cognitive skills, but we are lacking in technical skills, and as a result, we are not digitally literate, many of us, right? And that is also a big issue. According to some statistics, more than 90% of the population is digitally illiterate. Having access to ICT does not make you digitally literate, right? And that is a big issue here because most teachers and a large number of students are probably digitally illiterate. Well, it's not actually probably, I'm sure they are digitally illiterate. And that will be a major challenge when we want to transition to an online teaching learning mode. The other issue, as we use these technologies, we kind of sometimes do not pay attention to other aspects of using technology. For example, there is a lack of awareness about ethical and security issues because what you can do on a digital platform, or when you do something on a digital platform, what kind of risk you are getting exposed to, we are generally not aware of. And that might be a problem going forward. The other issue is when you use this technology, it might also have a physical and psychological impact. For example, now when I talk to my little nieces who are in the 6th grade or the 7th grade, they use smartphones in order to get their lessons from their schools. But they spend probably 3-4 hours just by looking at those smartphones. But if you think in terms of what kind of impact it will have on their eyes, right? When a kid, 10, 12 years old, looking at a smartphone for 3-4 hours during the day or even more, then obviously it will take a toll in their on the health of their eyes, or even the psychological health. There are a lot of psychological issues which might be important. People talk about addiction to your digital devices, and those are emerging issues which need to be addressed, which need to be really studied very well. So those are those are some of the challenges. The other issue would be the quality control. So how do we, of course, we can create learning and teaching materials, but then who will control the quality of those materials? When I say quality control, there are several different aspects. One is the correctness of the contents. Now, I have seen that many of my young friends in Assam and in other parts of India, they have, on their own, they have created learning and teaching materials, and they have posted on YouTube, they have posted on even on social media. Some of them are good, some of them are not good. There are mistakes, there are things which have been said or which have been taught through those videos which are not, which do not present the correct materials. So that could be a problem. And the other quality would be quality of the digital products. So when you post a document or post an audio file or a video file, what is the quality of those digital products, right? So that is another quality issue. And again, even ethical behavior and academic honesty are also part of this quality control as challenges, right? Because there are a lot of things available online, and of course, as educators, we have to follow strict ethical protocols. But when there is no strict guidelines, there are no regulations in that case, there may be misuse of all the materials which are available either online or offline. Then how do you teach those courses which require laboratory experiments? Of course, in this country, in the United States, what I have seen that you can actually since these are available on World Wide Web, I think they are not just restricted to the United States. And nowadays you can go online and you can do certain experiments from chemistry or physics online. And those are actually pretty neat. While I was preparing some of the presentations that I have done in last few days, I went and I tried to kind of do myself some of the experiments online. Those are, of course, simulation kind of, or those are obviously in the virtual laboratory, but quite interesting. And that could be useful for our students, but at the same time, I don't know whether they are enough. Those materials which are available online are enough to teach science effectively or teach those courses which require laboratory experiments effectively. The last point that I would like to share with you is, and that is a challenge, the students' psychological and individual academic needs. When I say that, again, this point I already have made, the students coming from a low socioeconomic background where their parents probably are not literate and they are too busy with their livelihood activities, and as a result, they cannot spend time with their kids. And for them, these teachers are their mentors. So they look up to their teachers for their mental nourishment, for their guidance, for encouragement. And in an online environment, that might not be possible. That will not be possible. Then there are individual academic needs. For example, as an educator, when I teach in my face-to-face class, I would generally teach for average students, right? So there will always be some students who are above average, and there are some students below average. But I would try to teach for an average students. But at the same time, I also make myself available for those students who are falling behind or who are not kind of up to what I teach in the class. and I will ask them to come to my office so that I can provide that extra help, which may not be possible on an online environment. Of course, because of the technology, it probably eventually will be possible, because now here in the United States, in most advanced countries, they use artificial intelligence, for example, right? So they use this adaptive learning techniques so that students, depending on their ability, depending on their level, the softwares itself, they kind of adapt the learning materials or the way they present their learning and teaching materials. And but that we probably will have to wait a few years in India before we can do it, and before we can do it, or before we can make it available for everyone. Because again, as I said, we have other problems, other issues, which are more pressing than to the point where we can actually use AI. And again, as I said, and as somebody who actually grew up in a rural environment, and for us, the kind of role our teachers used to play, and I'm sure even now for the young kids, the same kind of role some teachers play, and that is a very important part of growing up for those kids. And again, peer interactions are also very important. Of course, I am not a psychologist, or I am not somebody who has done any research on the child psychology, but they will say that this peer interaction, and one of the things that has been kind of debated in the United States. So now the US, even CDC is, the Center for Disease Control, has been issuing guidelines how to open the schools in August next month. And they are talking about this importance of this peer interactions for the overall development of the children. It is a controversial decision, or it has been a very controversial issue, but then even the experts, they have been talking about this importance of peer interaction. And these peer interactions, I would say, are even more important in a country like ours. Now, the question is, nobody knows, the experts don't know when this will be over. And according to World Health Organizations, in India is yet to reach the peak. And that means this will continue for some time. We have some good news in terms of, there have been some developments in terms of vaccine and the treatment. But again, according to the knowledgeable people, these vaccines, even if they are successful, will probably not available for general mass or common people until the middle of next year. And again, there have been some success in treatment. Again, that is still an evolving situation. So there are a lot of uncertainties going forward. How long it will take is not quite clear yet. So shall we close our schools and universities for another year? That probably will be too large a cost, or too large a price that we will be paying for this situation right now. Maybe there could be a hybrid model of partial opening and online teaching and learning. I think that we can open schools in rural areas in a measured way. And I would say that because there are certain factors or certain aspects of this situation which are favorable to rural areas. According to the experts, this virus does not spread more in open spaces. And in the rural areas, we have a lot of open space. People spend most of their time in the open space, right? And that might be something to kind of consider when we make that kind of decision. Second, well, the population density is relatively lower than in urban areas. Urban areas are more congested, and that might be one aspect which is favorable. And at the same time, there is less traffic in rural areas, meaning we don't get too many people coming from outside to the rural areas, and that might be helpful in kind of avoiding community transmission. And even if you look at anecdotally, rural areas have not seen much transmission. Well, there are a few exceptions, but so given that, maybe again, you will have to take utmost precaution, but eventually we may think of opening schools in the rural, because these are also the areas where we will not be able to provide online teaching or learning, at least immediately. Again, there could be online teaching for urban areas and also for higher education. Urban areas, I'm not saying that everyone has access to the internet, but then there could be some ways to get around that that problem or that challenge. Of course, teachers or the educators, they cannot do all these things in a vacuum. There should be clear thinking on the part of the boards, councils, universities, and they have to take a lead. And they have to take a lead in kind of getting around some of the challenges that I have mentioned in my earlier slides. In particular, they have to take a lead in developing online teaching and learning material, because again, the challenges are most of our teachers are not digitally literate, and secondly, there is the issue of big issue of quality control, right? And that's where these boards, councils, or universities can play a role. Delivery is, of course, is a major challenge, and we need government intervention. So in order to provide internet access, obviously government will have to. This is a classic example of a public good, right? And therefore, government needs to intervene. There, at the non-governmental level, there could be some initiatives. Again, these are probably going forward, may not happen immediately. There could be community centers here in the United States. I have seen that even here, although most people have access to ICT or ICT, there are people who do not have access to the internet or do not have to the ICT devices. So here, again, this is something that I seriously think about when I think about a country like India. There's something called Boys and Girls Club. These are essentially a voluntary organization that provides, that generally help the students. These are generally school level kids. They provide support, various kind of academic and non-academic support to the students who are from low socioeconomic backgrounds. For example, things like that. Some families, they don't have access to ICT devices or ICT internet, right? And so after school, so these Boys and Girls Club are open for these kids, so they can come there, spend 3-4 hours. They provide meals. They provide access to all kinds of devices. They will also provide facilities for, let's say, games, and they can play there. So those are at the non-governmental level. These are the non-governmental initiative. And maybe at some point, we may have similar organizations or similar facilities for the students who are from the low socioeconomic background in the rural areas as well as in the urban areas. Because even in the urban areas, there's a large number of people who do not have access to all these facilities that we have. And then I talk about a Uber model, which is essentially, let's say in a village, there may be 5 smartphones. And when I go back home, I look around. Even in my village, probably there will be 10, 12, or 15 smartphones. Of course, every family doesn't have a smartphone, but then these people with smartphones or have access to the internet, they may use their device or their access to the internet as kind of an income generating, not a big income generating asset, but then it may be, let's say, if they allow some student in the village to use their smartphone for 1 hour, they can charge, but then at the same time, or even the university or college in a crisis situation like that, they probably can pay, and these people with the access to internet or with the smartphone, they can let the students use their devices or their access to the internet. And the more effective things could be a network of educational resource persons, and that could be a network of educators, teachers, like who probably have a smartphone or have access to the internet. In addition to providing access to the devices, they may be able to provide guidance to the students living in various rural areas or in semi-urban areas. So those are some of the things that I think we can do going forward. Immediately, of course, since we don't have this network, there have been restrictions on our movement. It might be a little challenging. Going forward, thinking about the society, thinking about the country, thinking about the state, we have to have a systematic thinking about creating a very robust and resilient education system. What we have, it is obviously not working. It is in fact failing. For the last 4-5 months, our kids are not learning, and that is not acceptable as a society. Of course, we have to think, we have to have a vision how to integrate technologies into our learning and teaching process. There have been some efforts. For some reason, people are not aware of those efforts. For example, in India, under the Ministry of Human Resource Development, there is a digital platform called Swayam, and which has been operating for quite some time now. It's been 3-4 years, but then very few people that I have talked to actually know about it. And there are good materials. For example, when I looked at Swayam, there is, you can freely access a lot of books and documents which you can use for your learning and teaching. There are about more than 500 courses which are freely available on this platform. When I look at the universities and colleges which have, which are local chapters, or they are members of this network, I found very few from Assam and the Northeast. Most of these institutions are from the South. There are about 4,000 institutions which are members of this network, and they have been able to use this digital platform in order to learn and teach. Of course, there is a heavy dose of engineering, management, and science courses, because this platform is maintained or developed by IITs, and of course, Indira Gandhi Open University is a big partner. But then other general universities, I have not seen many of them being a partner of there. So we have some capabilities, but what I feel is that we are not using we are, even with our limited resources or limited capabilities, we are not using it prudently. Then universal access to ICT and digital literacy is a must. I think the government, of course, will have to play a role in providing universal access to the information and communication, particularly the internet. And digital literacy, we have to make sure that all the students and teachers in our educational institutions, they are digitally literate. They know how to use these technologies in order to create or edit or transmit information. Again, as I have been saying, or I think I said before, our institutions of higher education, they should get involved. And when they should get involved, they should do innovative thinking, and there should be rigorous research, because this will be a new mode of teaching and learning. And when we do that, there will be a lot of emerging issues. Like I said, it might have a psychological impact on our students. It may have a physical impact on ours. So who will find out whether it has? So we'll have to conduct systematic research, right? And who will take the lead? I would say that education departments in various universities and colleges, they should take the lead. Because if we don't do this kind of practical, very relevant research, then, well, we will not be able to make much progress. And of course, we'll have to have active collaboration with other stakeholders. Sometimes I feel that our educational institutions, they operate like islands, right? So they don't coordinate enough. We have, as a developing country, we have very limited resources. And therefore, we have to find ways how we can use these limited resources to the best possible way. For example, if Cotton University has some resources, why the students at B. Borua College or a Commerce College or even Dorong College cannot access to those resources, whether they are books, whether they are laboratories, or whether there are some other facilities. So there should be more collaborations and interactions so that we can, even in the short run, of course, going forward in the long run, we need more of those, but in the short run, we can use our existing resources, although they are probably in short supply, to the best possible use. And having said that, I think I will stop. I may have taken a little more than what I thought I would take, but thank you for listening. And I hope I gave you something to think about. Thank you.
Thank you, sir. So sir has given us about the challenges that we are facing in India, digital inaccessibility, digital illiteracy, then quality of digital products, etc. That we are really facing. We are not digitally very literate. We have teachers. We know that we are not very much digitally literate. So these are the problems. These are the challenges that we are facing in a country like India. Thank you, sir. Thank you very much. Our next speaker for the day is Mrs. Neelam Kolita. Mrs. Neelam Kolita is a health economist and works as a senior research fellow in healthcare modeling for Southampton Health Technology Assessment Center. Mrs. Kolita has worked on several economic evaluation of health technologies. She has contributed to evidence reviews of submissions to NICE single technology and multiple technology assessment programs on a wide range of topics. She also teaches in Center's external training program on Introduction to Health Economics. Prior to joining Center, Neelam Kolita worked as a health economic modeler for pharmaceutical consultancy firm and as a research assistant at Health Economic Modeling at School of Health and Related Research, University of Sheffield. Neelam Kolita's research areas of interest include public health interventions and global health with a primary focus on adolescent health. In 2019, Neelam Kolita was awarded an NIHR pre-doctoral fellowship to investigate health economic methodologies in primary settings. Neelam Kolita got her bachelor's in economics from University of Delhi. She has done her master's in development economics from University of Sussex in 2008, and then in 2011, she did her master in health economics and Decision Modeling from University of Sheffield. Now I request Neelam Kolita to start the session.
Thank you, Dr. Chaudhary, for the generous introduction. Before I start and I go any further, I would like to share my screen, if that is okay. Are you able to see my screen, the presentation?
Yes, ma'am.
Yes, are you able to see my presentation slide coming up?
Yes, ma'am. Yes.
Okay, great, thank you. Sorry, I'd like to repeat, thank you, Dr. Chaudhary, for the generous introduction. And I also thank the organizers of this webinar for inviting me. It is my absolute pleasure to be here. Hello to all the esteemed guests and the attendees. So in the last 45 minutes, we had a very insightful and interesting discussion by Professor Nath, who focused on the challenges in our education sector. So what I'm going to do is in the next 20 minutes or so, I will be focusing on the healthcare sector in India. And there are two issues that I will be focusing on: the current challenges that are faced in the Indian healthcare sector and the lessons that we can learn for future. Now, before I go into the details of it all, I thought it would be good to give a quick overview of the current situation in India. So we have got over 1 million people infected, out of which I think over 32,000 people have sadly died. Now, I have put the two figures that you can see. The one on the right shows the total number of deaths, and the one on the left shows the total number of cases. Now, what you notice is these lines, they are increasing, you know, although incrementally, marginally, but they haven't, you know, flattened. So what we want is flattening of the curve, meaning reaching the peak. So, you know, I think we have some worse scenarios to come. But that is just the current scenario. Now, in terms of the economic impact of COVID-19, I thought that this figure, which I got from the Center of Global Development, I thought it summarizes the impact of COVID-19 very nicely in a very simple and structured manner. And you can see the direct impact is on health sector, and that is obvious to us all. And the indirect impact, we can feel it on education, which Professor Nath has just discussed very nicely and in great details. And we are also seeing the impact in trade and commerce, in manufacturing, and so on and so forth. Now, the message that I would like to convey from this figure is that COVID-19 has got an intersectoral effect, you know. It's not just in health, but across different sectors. And this has led to a decrease in overall income through supply side as well as through demand side. Now, through supply side, we have noticed that there has been a decrease in production, which has led to increase in consumer prices of goods and services. On the demand side, we see that there has been a decrease in the demand for goods and services, which has led to a negative impact on businesses. Now, the challenges that we face, you know, the Indian healthcare sector faces. So I thought it would be useful to look at the supply side issues, and then we look at the demand side issues. Now, in the supply side issue, the first and most important.
Hello, ma'am. Sorry for interruption. Your presentation is not coming properly. It's not clear here.
It is not visible at all. From the very beginning, the presentation is not there.
Right. Okay.
Yeah. No
So
photo
let me.
evidence. Yeah.
Yes. Let me try and do that again.
Yeah. Sure.
I'm sorry. As you can see, I'm struggling with the IT here. I'm sorry about that. Can you see it now?
No,
No,
ma'am, not.
Yes. Just wait. Yeah. Now it's coming.
It's coming.
It's
Ma'am.
coming.
Okay.
Yeah, it's coming.
Okay.
Yeah.
Right. Can you see it now?
Okay. Nice.
Yes? Yes?
Yes,
Okay.
ma'am. Yes.
Do you want me to repeat what I have just said? Or
Sure, ma'am.
Yeah. Sure.
Is that
Many of
okay?
yeah. You can repeat.
Okay. Right. I'm really sorry about this glitch. You see, we all are learning as we are going. Anyway, so just to repeat very quickly, I provided this snapshot of the current COVID situation in India. So we have got, over 1 million people infected and over 32,000 people dying from the pandemic. And these two curves just shows that. And as I was saying, that we haven't reached the peak yet because the curves haven't flattened yet. And then just to ensure, can you still see my screen?
Yes, ma'am.
Yeah. Okay. All right. So, so in this slide, I talked about the economic impact of COVID, and the reason why I put this figure is that I thought it summarizes, very clearly and in a very structured way the direct and the indirect impact on COVID. Professor Nath today very nicely and in great details talked about the impact on education. Here, I will be talking about the health sector. Now, I was here, so the challenges that we face. So in the supply side, the most important challenge that we are facing in the Indian health sector, I think, is the excruciatingly low public expenditure in our healthcare sector. Now, health sector has never been a priority sector in India's growth and development story. Because you see, the public expenditure of Government of India, I think according to 2017 estimates, stands at 3.5% of our GDP. Now, if you compare that with Germany's 11% or South Korea's 8% or New Zealand's 9%, we are way behind. Now, and I also argue this because India, in terms of GDP, it's the 6th largest economy. So I think we have a lot to catch up to. Now, what this low expenditure and low investment in health sector has resulted in is low capacity of our health system to withstand any external shock, let alone be such a shock of this, gravity. We have low infrastructure. There is lack of availability and accessibility. Just like in education, we have the same problems here in the healthcare facilities, including hospital beds, ICUs, ventilators, personal protective equipment, diagnostics, and so on. The third issue that I have put here is about, I call this human power crisis in healthcare. And I'll explain you why. According to 27 estimates, these are data published by the World Bank, the density of Indian health worker per 10,000 population is 20. That means we have 20 health workers per 10,000 population. Now, this 20 health workers include approximately 8 doctors. So to translate that, what does it mean? We have approximately 1 doctor per 1,000 population. So you see, there is a crisis there. We do not have enough health personnel to deal with the demand, with the population size that we have in hand. Obviously, we have poor emergency services, And the last one that I have put is the pressure on provision of services and care for non-COVID conditions. Now, COVID, we all have seen that because of all this, closures and, all this social distancing and all of that, the focus has been on treating COVID patients, on stopping the disease from spreading and attending to the COVID patients. Now, in doing that, other patients who require other emergency services like maternal and child health, you talk about patients undergoing dialysis for say kidney conditions, or you say patients who are going radiation therapy for cancer. Those services have come under tremendous pressure. So these are our supply side issues. Now let's look at the demand side issue. Now, we are, of course, 1.3 billion size population. We have a high population density, which means for a communicable disease like COVID, it increases the risk of community transmission. And the next one, what I call is the proportion of high-risk population. Now, in India, we have a substantial proportion of people with pre-existing comorbidities, meaning people who already have diabetes or say heart conditions or respiratory conditions. Now, the World Health Guidelines suggest that those with existing morbidities and those who are elderly, over 60, 65 and above, they are the high-risk group. Now, not to bog you down with statistics, but just to give you a picture of the problem, is that you see we have almost 6.5% of our total population is aged 65 and above. Now that's a small percentage, but if you think in real numbers, that counts to 92 million people. Now, if you add those with pre-existing comorbidities, it's a massive population size who is at high risk. Then the last issue, the demand side issue I have put is negligence due to economic poverty. Now, what do I mean by this? What I'm trying to convey here is that COVID-19 puts highest risk to economically disadvantaged population. We all have seen the plight of the migrant workers. It has made international headlines. But what I would also like, it's not just the migrant workers, it's also those in rural areas or those who are living within the threshold of poverty line. Usually they have got high burden of existing illnesses, and that is because there is high proportion of malnourishment, and it has studies show that those who are economically disadvantaged, or you see in rural areas with low connectivity and lack of awareness and all of that, they are usually immunocompromised. Then it is not just restricted to the rural population. If we look at urban slums, who may not be necessarily, living within the threshold of poverty line, but the issue there is, again, it is a high density. These urban slums have got high density of population, and most of them work in the informal sector, where they do not have the luxury to sit at home and work from home and go about on their life. They need to get out there, so it is not possible to socially distance and keep washing hands, if you like. So all these issues leads to increase in the risk of infection, which in turn leads to increase in demand for healthcare services. Now, what I call this imbalance between the supply side and the demand side is precisely what the problem is in the Indian healthcare sector today. And I think COVID situation has just reiterated that. Now you will ask me, so what can we do about it? Now, my answer is simple. I think what we need to do is we need to prioritize health. But I'm equally aware that it is a mammoth task for a country as huge as India. But having said that, I think we need to take really concrete steps. There need to be local and national initiatives, and there needs to be this push for increasing, the government expenditure on health to at least 5 to 6% of our GDP. Now, what that would do is it will provide the much needed infrastructure, mainly in the rural and marginalized areas, for better availability of healthcare services and personnel. Then I talked about priority setting. So I put this slide, it's just as a reminder for us just to have an understanding of what priority setting is that I'm talking about, why do we need it, and how is it relevant? So why do we need it? Let's talk about why do we need to prioritize health? What is the need for it? Now, as Professor Nath has said, the issue that we see in the education sector is similar what we see in the health sector. We have got scarce resources. So there are trade-offs that needs to be made. We cannot invest in each and every programs or interventions. We need to be very clever and smart about our investments. So we need to make choices. And priority setting just enables us to do that. It is a formal process of distributing the resources to address the most crucial health needs by choosing among competing options. Now, you might ask me, so why is it relevant then? How is it relevant? Well, it is relevant because I would argue that this priority setting is relevant because this process is the means to achieving universal health coverage, which requires the resources to be allocated fairly and efficiently. For those of us who do not know, universal health coverage is one of the sustainable development goals of United Nations. And what it means is, it doesn't matter where a person is born, rich or poor, girl or boy, born in developed or less developed country, they should all have access to free health. It is their right. Now let's talk about this in the context of India. Now, my understanding of the Indian situation is that the current government has worked, has worked to address the issues in the healthcare sector, although they have worked slowly but surely. Okay, India is moving towards evidence-informed healthcare policymaking. In the sense that we have established the Health Technology Assessment Board. I think it was late 2017, 2018. And the whole objective of this Health Technology Assessment Board was to help prioritize and allocate healthcare resources fairly and efficiently. Now, those of us who do not know, health technology assessment is a multidisciplinary approach that takes into account economic, medical, social, and ethical considerations in a systematic and transparent manner to inform policy. Now, there are 3 criteria based on which the Health Technology Assessment Board makes their recommendations for decisions on resource allocation. The first one is health maximization. The second one, equitable distribution of health across the vulnerable and least developed areas, so that those who are not the have-nots are not missed out. And the third and most important, I think, is the reduction in out-of-pocket expenditures. Now, mind you, here in India, our out-of-pocket expenditure is approximately 65% of current healthcare expenditure, and it is a massive amount which we pay out of pocket. And that is because of the increase in demand for private healthcare. There are many of us in this webinar today who we have used the private healthcare sector, and we have, economically, financially, we have borne the brunt of it. It is really expensive. But what I'm pleased to see is that the government of India has made provisions for free testing and treatment for COVID-19 under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So this is all going in the right direction. But the question is, have we done enough? Are we there yet? I think no. There are still massive gaps. There are massive potholes that needs to be addressed. Now, having said all of this, I also did think about, how does COVID-19 fit in all of this? What I have just talked, especially in the health technology assessment board in the context of their informing policies and making healthcare decisions. I think, the three criteria that they have, I think it's all well and good. But I also do think that COVID-19 has, I think, exposed the need for a comprehensive and rigorous assessment. There is a need to consider and provide safety net for those patients who are non-COVID. The impact on, I talked about earlier, emergency maternal and child health, tuberculosis, or say dialysis for chronic kidney conditions. These are expensive treatments. So, we need to build a safety net. And that's why I say we need to emphasize on the externalities. The next one that I think is in the health technology assessment context, costs which are direct and indirect medical expenditure, so the are taken into account. So the focus is only on medical expenditure. But COVID-19 has shown us that we need to also look at the non-health sector cost, because in the earlier diagram that if I can go back in this diagram, we have seen that it has got this spillover effect across different sectors. So, we need to take that into consideration. And how do we do that? To take into account this broad, non-COVID sectors as well, so non-health sectors as well, we need to have a broad societal perspective, and not just the payer perspective, the one who is going to pay. In this case, I'm talking about the government, who will be paying for just the health expenses. The government needs to be kind of, it needs to provide this umbrella of support to the other sectors as well. And lastly, usually what we see in health technology assessment, that there is this a fundamental principle that focuses on equity, efficiency criteria. What that means is, equitable distribution, as I said, not leaving the worst off behind, focusing on them, getting the most vulnerable, having access of healthcare to the most vulnerable sector. And what I mean by efficiency is, does it give me the value for money? I mean, I'm not going to invest this much billion of rupees if I don't get the return. So, is it cost effective? Is it does it give me? Is it worth the investment? So there is always this, there is this trade-off, and policymakers always try to find that right equilibrium, if you like. But I think that needs to be reevaluated in the context of COVID. And I'll tell you why I say that. It's because, you see, earlier on I did say about our statistics. I mean, it's mind-boggling, which is we have 1 doctor per 1,000 patients. Now say, if we do not protect our health workers, the doctors, properly, if we do not provide them the proper services, if we do not provide them the proper personal protective gear, then if they are exposed to COVID, the brunt of it will be felt by the 1,000 other people, because there wouldn't be anyone who would be able to look after them. So I think, this argument that, we should always look for the most worse off, or the economically disadvantaged, rural, and all of that, I think that also needs to be reevaluated, because in this case, we want our doctors to be protected well, and they are not necessarily economically disadvantaged. Surely vulnerable, but not economically disadvantaged. So for my conclusions, what I'd like to conclude is I think COVID-19 has reiterated the need for much deserved appropriate investments in healthcare sector. And I also do think that it provides an opportunity for our government to build the health system that was always needed and which now cannot be delayed any longer. It just needs to be prioritized. Investments need to be made. We need to address those gaps. Thirdly, there is a need for public provisioning of health systems. And of course, we really need to reduce the reliance on private sector, because this demand for private sector is what increases our out-of-pocket expenditure. And there are many studies that shows that, there are evidence that out-of-pocket expenditure for, especially like, the cost of care and all of that can really pull a household into poverty. And lastly, we need to strengthen the social safety net to enhance the resilience of the population, given the interconnectedness between health and livelihoods. So that's all I had to say. Thank you for listening to my presentation patiently. Thanks, and I'll stop sharing my screen now.
Thank you, Neelam Kolita. After having a wonderful session and mesmerizing speech by our speaker, now we proceed towards the most interesting segment of this webinar, that is question answer session and feedback session. So, first of all, the student of Narangi Anchalik Mahavidyalaya, Gunja Kumari, she's a student of post-grad economics with our major subject. So I'd like to ask one question. So, Gunja Kumari, unmute yourself and switch on your video.
Good evening, everyone. Respected principal and all the teachers. My name is Gunja Kumari, and I am a student of Narangi Anchalik Mahavidyalaya with an economic department. I want to ask a question, and question goes to Hirayana sir. My question is, does the technological give us a strong educational foundation and encourage creativity? Thank you.
Thank you, but I think I did not hear the question properly. Can you repeat this?
Yes, sir. Does the technology give us a strong educational foundation and encourage creativity?
Yes, thank you so much for this. It's a very important question, and I think yes, it can, but I would not advocate online teaching or technology-based teaching. I mean, to be the sole way of teaching and learning. I think it can provide a very good support to our existing teaching learning system. And again, there are certain issues which I have highlighted in my presentation. For example, when we talk about technology-based remote teaching and learning, of course, how to control for quality, or how to make sure that we have, in terms of the content of the of those online teaching and learning, they are of quality and they are they can add value. Those are the things that we have to really pay attention to. But then I think that, yeah, technology can, or technology-based, this kind of online teaching can be a component of the overall teaching learning process. So if that is what you are kind of asking, okay, thank you.
Thank you, sir.
Yeah, now I ask Madhurya Bhuya, the students of 6M, to ask question. Is Madhurya available here? Madhurya,
Yes.
are you here?
Yes, sir. Yeah.
Okay.
Good evening, everyone. According to Indian Standard Time, I am Madhurya Bhuya. I'm a student of BA Economics 6th semester, Narangi Anchalik Mahavidyalaya. And my question goes to Neelam Kolita ma'am. The question is, what is the real economic cost of delayed medical treatment to COVID-19? Thank you.
Thank you, Madhurya. This is a really interesting question, and I do not have a figure. I do not have a figure in mind, but what my understanding says is I think we'll just have to wait and see the long-term impact. There are a lot of studies going on. We are seeing, it's the impact on the across the sector, the spillover effect. But we have seen the impact on education. Now, some of them, I think health sector is one where we will see the direct impact. We can feel it. But other like trade and commerce, there has been unemployment in the aviation sector. Tourism industry has gone into a lot in recession and stuff. So the real cost, I think it is too early to say. We'll just have to wait. But what I can say is we can learn from previous pandemics like Ebola in Africa, for that matter. And what we have seen there is, the real brunt, the real cost has always been paid by the most disadvantaged, economically disadvantaged population. Especially, we have this adolescent girls, maternal, and rural population. So I think, to answer your question, I do not have a specific figure in head, but it is only, we'll have to wait and watch. Does that answer your question?
Okay, thank you.
Okay.
Okay, thank you.
Yeah. So there are some questions which the participants put in the chat box. So I'm picking one question. The question is from Parasmoni Bibasha. His question is, what can be an alternative to so-called online examination, which can make assessment and evaluation more neat, especially for school children? What methods are being used in the US for this purpose? The question goes to Professor Hiranna Kumar Naksar.
Thank you so much. Again, this is something that we have been struggling a lot, even in the United States. And I am not really familiar with the kind of assessment method they use at the school level when they do teaching and learning through online mode. But at the university level, because we have been teaching online courses for quite some time now. For example, I have been teaching online classes for last 10 years. So initially that was a big issue. So how do we make sure that students can, we can do a proper assessment of what they have learned. And back in like 2010, 2011, we used to make students come to a physical location and take the exam. Of course, we did not have much control over how they do their homework assignments, which are not necessarily have to be done under a proctored condition. But recently, there have been some technologies which we use in order to give online exams, which are essentially, these are softwares which are used to proctor the exams. And of course, there are a lot of issues which are still evolving. Even if we use a technology in order to proctor an exam, which are essentially almost the same as giving an exam in the class, but assessment is always well, as you all know, that it's something which evolves over time. and there is no perfect assessment method, I guess. And therefore, we are kind of learning those things. Again, I think you wanted to know more about assessment at the school level, but again, I am not very familiar with the assessment they do when they teach online at the school level. But at the university level, yes, nowadays we do whatever we do normally in face-to-face classes. We use technology. For example, I am using something called a Respondus Monitor, which is a software that the students have to download a specific browser. When they use that browser, all the other browsers are shut down so that they cannot use the internet materials. Then they have to take the exam in front of a camera. So everything is recorded, and the software will flag whenever there is something which is suspicious. So that is the way we administer exams for online classes. And but then when it comes to review materials or other kind of assessment, I use different and at the same time there are other ways. For example, we also can use technology to generate multiple versions of the test. That is one thing that we did early on. So it is not the same question that the students will get. They will get different. And then nowadays, the other interesting technological development is the use of artificial intelligence, which essentially the software itself will assess the ability of the students or how much they have learned, and then they will adapt their materials and the questions accordingly. So I think going forward, even for particularly for the small kids, I think that will be a way to teach online classes. And even if you look around, like if you go online and Google, I think you will find a lot of places. You can see a little bit more about this adaptive learning softwares, and where even the software itself will determine what kind of assessment question they have to put to the children. I think that will be, and already it has been prevalent to some extent in the US. I think even for the school kids, they use it. And the publishers, the textbook publishers, they have come up with very nice programs, which we sometimes use in our classes, which has not been used extensively. But going forward, that's where I see this kind of technology-based teaching and learning going. And again, that is a risky proposition for us educators, because what if like 10 years down the line, they say that, okay, so you guys don't have to teach, we can do it by machine. Thank you. That's kind of a interesting thing to note about technology-based teaching and learning.
Thank you, sir. The last question, the question is from Nagendra Boro. Due to COVID-19, thousands of students of higher educational institutions outside of Assam have come back to Assam. So what will be their future education?
That is for me?
Yes, sir. This is for you.
Well, again, this is obviously a very uncertain time. So the students who have come back from wherever they were, and what will happen to their future education. It is probably a similar question, what will happen to the workers who have come back to their home states from where they used to work. And obviously, I would say probably the colleges or universities they are attending, they will pay attention to this phenomenon, and then they will find some solutions. If not like face-to-face physical learning, they probably will provide a way for students to learn remotely. And at the same time, I think the students on their part, of course, it will be an uncertain time. They probably will panic. They will have, it will have a psychological impact on them. But this is an extraordinary situation for everyone around the world. And therefore, they should have patience. At the same time, they should make use of their time as best as they can. There are a lot of materials available online, and I am sure many of the students probably will have access to the internet. So they use their time to find those materials, and on their, of course, on their own. Well, there are some guided materials. So if you look enough, I think you can always find those, and they should try to continue building their human capital when they are facing this extraordinary time, extraordinary challenges. And I think it is the responsibility of the universities or the institutions to make accommodations for students coming from different parts, the kind of accommodations we are making in the United States. For example, we are reopening for our new academic year in about 2 weeks. And here we are giving students an options if they, for some reason, cannot come to class, because we will be in a hybrid model, meaning we'll be teaching one day, we'll be teaching online, we'll be teaching face-to-face one day, we'll be teaching online one day. And we also recognize that some students probably live in other countries, some students probably are not around here. And because of all the risk factors, they may not be able to come to the class on the day we teach face-to-face. In that case, we are giving them the option to learn remotely. And we make, as an institution, the university is making all kinds of accommodations to the students. So I would say that it is the responsibility of the institutions to do that sort of, or make that sort of accommodations. At the same time, given the situation, I would also ask the students not to panic. At the same time, to make use of their time at home to learn and to continue to learn. I think that would be my advice. But again, for all of us, for educators, for parents, for students, it's a very difficult, it's an once in a lifetime kind of situation. And not only people in India, but everywhere in the world, they're facing the same situation. So I think it is important to be patient. It is important to be, you have to hold up to your spirit. I think that's very important. Thank you. It's a good question, but I don't think I have a clear answer.
Thank you so much, sir. Now we have a quick feedback session. So may I now request Monimala Bhattacharya from San Francisco, US, to give a quick feedback on our webinar. Over to you,
hello,
Monimala.
everyone. Thank you so much for having me. So it's been a beautiful discussion, actually, very, about health and education, how it is affected. So as Mr. Hiranyanath has said, so I'm from San Francisco, California. So I can only speak about education here because I have two children. My daughter is an 8th grader and my son is a sophomore in Berkeley. So what's going on here is, as he has already said, the COVID situation is such like an extraordinary situation right now. And we, even here in US, we are not equipped to handle such a situation. Even the teachers are not so trained that they are able to have this online, especially the school, the elementary level, middle school, and the high school. So it's as Mr. Hiranyanath has said, it's a learning process. Things are starting up, and for the current like here, like every state is following a different way. Some are having classroom instructions, some are suspending it. So for us, they have suspended for the fall semester, both in the UC system as well as our school district. So it's been very difficult for the students because they have been technologically, they have been doing their homework online, they have been doing their projects online, but they are not used to having instructions online. So that's something they are learning and they are doing it. And I'm sure India will have much tougher situation in this regarding this, because I know, like as he said, like only 40% of the people have internet service. So this is a learning process. So we have to, get over this and see how it takes us along. And as he said, the kids have to use their time well. If we are not able to, like if you're online, not just because now everybody has a phone. If not, you don't have a laptop or you don't have a desktop, but you have a phone and you can use it. Internet has so much of information out there, and if we can use that information to learn a different skill, to learn more, it will be very helpful for their future. So I think that's about it. John, you can carry on to the other person.
Thank you so much. So here we end the feedback session. Now I request Banajyoti Sharma to give vote of thanks. Thank you.
Thank you, sir. It has been a very great evening today with all of you around participating in this webinar, and I, Sri Banajyoti Sharma, Assistant Professor of Economics Department, on behalf of Narangi Anchalik Mahavidyalaya and specifically Economics Department, extend a very heartfelt thanks to all. First of all, I would like to thank today's Honorable Speaker, Dr. Hiranya Kumar Nath, for giving us an opportunity to hear his very informative, thought-provoking and mesmerizing lecture. Thank you, sir. I am immensely thankful to our other speaker, Mrs. Neelam Kolita ma'am, for her ideas and elegance of explanations of everything. Thank you, ma'am. I sincerely hope each one of our participants have been benefited. A special mention of our principal, Rita Datta Hajorika ma'am, for being the catalyst and stimulating us to do our best and standing as pillar of strength. Thank you, ma'am. With a deep sense of appreciation, I would like to offer my gratitude to Rita Sharma ma'am, the coordinator of IQAC, for her untiring effort. I would like to give special thanks to Homeshwar Koltia sir, who has been working behind the scene and technically coordinate everything to make the event successful. Thank you, sir. I would also like to thank the coordinators of today's webinar, Dr. Jutika Bormon Choudhury ma'am and Jayanta Barua sir, for their enormous effort to organizing this webinar. Last but not the least, a big thank you to all of the participants, including our students and viewers around the world, for being a part of this webinar and making it successful. Thank you all. Now, I request our principal ma'am to announce the webinar is over. Thank you.
Ma'am, unmute your audio. Ma'am, unmute your audio. Principal ma'am, unmute your audio.
Okay, thank you, Janta. Thank you. So, thank you very much, Professor Hiranya Kumar Nath and Neelam Kolita, for deliberating an informative and thought-provoking lecture as a resource person. It was really a splendid presentation to which focused the various angles of COVID-affected economy, such as problems on online education, economic and health conditions of underdeveloping country like India. All the participants appreciated and got benefited in many respects and would like to be in contact for future complaints to sir and ma'am. And thank you again. And thank you organizers And thank you all for taking time out of your schedule and joining us with this webinar. I announce this webinar is over. Dhanyabad aru Shubharatri.
Thank you. Good night.
Thank you. Good night.
Good night, sir. Good night, Neelam.
Good night. Thank you again. Thank you for everything.
Yeah.
Good night, everybody.
Good night, everybody. Good night, Janta Burwa.